When it comes to caring for kids, it's not always just about what's wrong medically. Sometimes it's about what's happening at home, at school, or in their world that no one has taken the time to understand. This week, we're talking with a provider who believes listening is just as important as diagnosing, and that building trust with kids and families is where real care begins. Let's get connected. Welcome to Connected Podcast by Healthy Connections. I'm Marisol, and each week we sit down with the people who are making a difference in healthcare across Arkansas. Today, we're talking with Dr. Jeremy Porter, a pediatric physician seeing patients at our Hot Springs Central location through My Kids Pediatric Clinic by Healthy Connections, a dedicated pediatric program focused on caring for children from infancy through adolescence. Alongside providers like Dr. Tracy Rowe and Melanie Newman, APRN, he's helping care for children and families right here in our community, serving families across Hot Springs and the surrounding area. In this episode, you'll hear his journey into medicine, what drives his approach to caring for kids, and why listening may be the most powerful tool a provider has. Dr. Porter, thank you for taking the time to be with us today. Let's start with your story. What led you into working with kids and ultimately into medicine?
I went to college, and my plan was to be an elementary ed major because I knew I loved kids and I had a way of communicating with kids that was, made me a little bit talented. And I thought I'd use that to be a teacher. And things were going along smoothly until my wife and I took a mission trip to Kenya one summer and doing, charitable work there. And, during that time, we ended up seeing so much suffering. And, I thought I can go and be a teacher anywhere in the world. But if I were a physician, I could actually make an immediate, acute difference in the lives of these kids. I decided I'd change my major to pre-med. So fast forward years later, I served in the military for 4 years, and after that we started looking around where we want to go and landed here in Hot Springs, Arkansas.
That's one of those moments that really changes the direction of everything, and it's something that still shows up in the way you care for patients today. And now you're here, working with families in the community you serve every day. When we come back, we'll talk about what caring for kids really looks like and why listening might be the most important part of the job.
Sometimes when I don't feel good, my mom takes me and my sister to My Kids Pediatric Clinic in Hot Springs.
We love it because it's not scary like other places. And my dad loves that they accept all health insurance, including our kids first. They always see me, even if we don't call ahead to make an appointment. We've been going there since we were newborns, and I hear they are accepting new patients.
So, fellow kids, tell your parents to take you to My Kids Pediatric Clinic.
When you think about the kids you see every day, what stands out most about the kind of care they really need?
It's easy to take care of kids because they usually get better. Their medical problems are usually simple. More often than not, the problems that really plague them are the problems having to do with the home that they live in, or poverty, or hunger, problems with completing their schoolwork. And it takes a little bit of investigation sometimes, and intuition and concern. But with enough of those things, you can really try and figure out what's going on with a kid and really help them to be better from a medical standpoint and from a social standpoint and academic standpoint and all of the above.
You mentioned looking deeper than just the medical side. How do you actually connect with kids and build that kind of trust?
So I love that challenge, and I love that I can be a big goofball and play with the kids. And I can tell whenever I talk to kids that a lot of times they're not really talked to or communicated with by adults very, very often. In other words, if I listen to a kid and I look at them in the eye, sometimes it seems like they act differently because they're being taken seriously, and they haven't been taken seriously very often. And so that's kind of a key to getting into the mind of a kid and really getting into their heart and being able to make a difference in their life.
And that connection doesn't just impact the kids, it affects the whole family. When you're working with parents, how important is communication in the care process?
I realized that even though I'm in medicine, so all of the technical training behind getting me to the place where I can practice has been obviously essential. Being able to communicate with a person really makes the biggest difference in a doctor's ability to actually help somebody. And so I think that what has helped me to be successful or be effective in what I do is that it seems kind of natural to me to listen to somebody. And when parents talk about what's happening with their kids, I listen and I ask them, is there anything else? Is there anything else? What about this? What about this? Help me to really understand. And parents, it's different for them.
And when you take that extra time to listen, what does that allow you to uncover that might otherwise be missed?
I think that they feel like their kids are being really well cared for whenever the doctor listens to all of the details about what they're thinking. And I know that if I keep listening, I'll get to the second layer and the third layer of things that they wouldn't have ever told anybody. And a lot of times, it's not that I always need to know all those details, but sometimes the diagnosis is in the details, and sometimes the key to changing the way that the family operates is in the details of hearing the story.
And that trust you're building, how does that change the way kids respond to care?
Listening to kids builds trust, and whenever they trust you, they'll take the medicine you give them. Whenever they trust you, they'll want to come back whenever they have an illness. Instead of going to urgent care or the ER, instead of just grinning and bearing it, they'll want to go where they feel like they're really going to be cared for.
That really gets to the heart of what care is supposed to be.
Remembering the care part of the healthcare, not to be cliche or anything, but remembering the care part is where doctors fail so often. And so whatever will make a doctor successful usually ends up being not the technical knowledge, not the manual skills, but their ability to communicate and listen, and actually that comes from caring.
And one of the things that makes care like this possible is access, making sure families know they have a place to go when they need it. For families here in our community, what would you want them to know about bringing their children in for care?
Anything comes up, let me know. I'd be happy to help out with your kids, happy to help out with their sports physicals, school physicals, or whatever kind of bump in the road your family comes into. That's what I'm here for.
If your child needs care, whether it's a checkup, a physical, or something that just doesn't feel right, our team is here to help. Dr. Porter sees patients at our Hot Springs Central location through My Kids Pediatric Clinic by Healthy Connections, where he and the team are focused on providing thoughtful, relationship-driven care for children and families. To schedule an appointment, call 888-710-8220 or visit mykidspediatric.com to learn more. You can watch or listen to this episode and others at healthy-connections.org, as well as on YouTube and Spotify. Until next week, stay healthy and stay connected.